Hello, welcome everybody to our virtual Lunch and Learn here at the Denver Rescue Mission. Thanks so much for joining us today. This is the first one that we've done like this, so I hope you can offer us a little bit of grace as we kind of work through, in case we do have any kinks. But again, we're really excited to be able to bring this to you today. We have our two guest speakers, which I will introduce a little bit later on. Griff Freyschlag, our Vice President of Development, and Jessica Winslow, our Senior Director of Residential Programs. And like I said, we will get to them here in just a few minutes. My name is Brad Jessen. I'm the Director of Philanthropy here at the Mission, and I work in our development office and have the privilege of working very closely with our donors and other partners in the community. And it's my honor to be your facilitator for this Lunch and Learn today. So thank you again for joining us. Wanted to let you know that if you are having any technical issues, feel free to call or text our web manager. His name is Robert, and he will be happy to assist you. Here is his phone number. It's 419-688-7220. And once again, you can get a hold of him if you're having any issues technically getting connected, or your audio, or whatever the case may be. He will be able to help you out with those issues as we work through our agenda and our program for today. But first of all, what I want to just say to all of you is thank you for your support. Those in our audience today include some of our leadership donors, our monthly donors, those that are part of our Pathways of Hope that have pledged to donate on a monthly basis. We're excited to have many Pathways of Hope members on this webinar today. And then we have a really strong group of our young professionals as well. So this is a newer group that we just started about a year and a half ago now. And again, these are young professionals, many of them under the age of 40, that have joined this group to help support the mission in many different ways through volunteerism, advocacy, just learning more about our programs, and of course, giving financially as well. So we thank the young professionals that are on the call as well today. I do want to introduce a couple of other fellow staff members that work alongside me in the development office. They are not today's speakers, but they're definitely people that you should know because they invited many of you to join us. So let's see, I want to introduce, and we'll give them a second here to introduce themselves as well and just say a few things. But Mindy Robinson, she is our Donor Relations Associate. So she works again with many of our leadership donors, and is also our liaison for our Pathways of Hope, that monthly donor program. So Mindy, I'm gonna just toss it over to you and let you say hi to everybody.
Hi everyone, again, as Brad said, my name is Mindy Robinson, and I am with a Donor Relations Associate here at Denver Rescue Mission. I've been with the mission for about 2 years now, and I just want to thank all of you so much for your support and for being part of this today. That is really what gets me excited to come back to the mission every day, is just seeing your gifts at work and the ways that we are learning to support our community experiencing homelessness in new and necessary ways. So thank you so much for being here today. We're excited you join us.
Awesome, thank you, Mindy. And I also want to introduce Christy Alfano. She's also a Donor Relations Associate here at the Mission, again, working with many of our leadership donors, and then also working closely with our young professionals team as sort of our staff lead for our YP group. So Christy, I'll throw it over to you so you can introduce yourself as well.
Thanks, Brad. Hi, everybody. So as mentioned, I'm Christy Alfano, and I'm originally from New York. I moved to Denver about 8 years ago with my husband, and have been with the mission for about 2 years. And just what drew me to this organization was the opportunity to work with people in their most vulnerable times in the name of Christ. I mean, that was the huge piece for me. So I also want to echo what Mindy said, just a huge thank you to all of you. I mean, everybody on this webinar right now is supporting us through prayer, financially, volunteering, one or any of those. So thank you so much, and hope you enjoy.
Awesome, thanks, Christy. And I also want to just let you guys know, if you have questions or for more follow-up afterwards, Mindy and Christy will really be your, again, your main contacts, again, depending on which group you're part of. They will be available again for questions and that kind of thing afterwards for you to follow up. So we'll make sure you get that contact information published as well. on your little chat feature. So just a few logistics before we dive into some more content. First of all, everyone that's on the call, you will be muted throughout. So just realize that that's kind of how we have this this webinar set up. But we do want you to speak and ask questions through our question and answer feature, which you should be able to see that on the screen there. If you go ahead and click on that little question and answer icon, you can go ahead and ask questions of our presenters through that feature. Many of you have, when you registered for this event, I think we got 10 or 12 questions that came through from many of you. So we will get to those closer to the end of the program. So know that we'll be jumping on those. But again, we want to hear from you throughout. So if you have other comments or questions that you think of as we're kind of working through this, please don't be shy, and please go ahead and enter those through that question and answer the Q&A feature. In a few minutes, I will ask our speakers to provide a little bit of an overview of what we've seen during this crisis, a little bit about also kind of what we do on a regular basis here at the mission. So that should take about 15 to 20 minutes total. And then, like I said, during the last half of the program, we will go into your questions. So again, feel free to go ahead and chime in, and don't be shy and ask those questions as we work our way through. So here at the mission, we are definitely faith-based, Christ-based organization, and we're a praying organization as well. So again, before we dive into content, just let me pray for our time together, and then we'll move into our speaking portion of the event. So Heavenly Father, we thank you for this time. We thank you for all of the supporters and donors and everyone that has signed on today. We thank you for their generosity. Lord, we know that we can't do this work without community partners. And Lord, I just pray that you bless them and honor them. Lord, I also pray for our speakers today, everyone that's on this call. Lord, be with all of us, keep us safe. And Lord, especially we pray for all of those staff that are working as we speak on the front lines, right now serving lunch at the National Western Center and all the other places that we have guests and residents with us right now. Lord, I pray that you keep them all safe, keep them healthy, keep them strong, also uplift them, inspire them to continue to do your work around the mission and throughout the city. Lord, we just bring all these things in your son's name we pray. Amen.
Mm-hmm.
All right, so just a couple of things just to provide some context before I turn it over to Griff and Jessica. As you all can imagine, the last 5 weeks has been a really extraordinary time here at the mission as we've responded to this COVID-19 crisis. And of course, it's been extraordinary everywhere around the world, but especially at a place like the mission that literally is crowded with those seeking help really 24/7, and it serves the most vulnerable in our community who are facing, on a regular day, are facing some really extreme crisis in their own lives, and to layer on top of this COVID-19 crisis, and it's been a challenge. It's been a real challenge. I know Griff will dive into a little bit more about exactly what we've been doing to respond. But it has raised some questions on the mission. I mean, how do you keep everyone safe, including staff, when many of our staff, upwards of 90% of our staff, cannot do their jobs from home? What does that look like? And as I said, Griff will dive into more of that. And a lot of our healthcare workers and our first responders around our community obviously has been getting a lot of attention in the media, and rightfully so. But I also want to just mention our frontline workers and what heroes they are at a homeless shelter. That again, social distancing is a difficult thing to do when you're working with upwards of 700 individuals every night in just one case in terms of what we're trying to accomplish. So it's been amazing to see them and our volunteers continue to come out and support our guests and others that find themselves in the middle of this crisis while they're homeless, which is one of the most difficult things that I can imagine. So around the mission over the last 5 weeks, really the kind of the key terms and mantras are, how do we adjust? How do we pivot? How do we partner better with the city of Denver, with other community organizations, other nonprofits, and do all of that in a context that is, it's a crisis out there. But while doing that, while still sharing the love of Christ, and showing the peace that we have inside of us because of our relationship with Christ. And so that's been the challenge, and I feel like our staff has done an amazing job of being able to do that and coming out and being a leader in the community, and again, and really trying to address the issues of our homeless community and trying to keep them safe. And so I'll let Jessica and Griff really dive a little bit more into that in a minute. But first, I do want to take just a step back. I know we have some folks on the webinar and on the call today that maybe don't know a whole lot in depth about what we do at the mission on a regular basis. Most folks know us for our shelter services, our meals, the Lawrence Street Community Center, the Jesus Saves sign down on Park Avenue. For those of you that do live here in Denver, you know exactly what I'm talking about. But we actually do have 4 core strategies that I'll touch on really briefly here that we undertake every single day, again, to try to reach those in the community who are experiencing homelessness or poverty, and again, help reach them with the love of Christ, but also reach them to the point where they can become self-sufficient. And so, there's a lot of different needs. Everybody who's homeless becomes homeless for, it seems, seemingly a different reason. And so we have developed these 4 core strategies to try to address those issues for those people that are, again, experiencing homelessness. So the first one is emergency services, and that's one I already mentioned: the meals, the shelter, showers, restrooms, just the real basics. And for many folks, that's an entry point to other longer term solutions. And so, there are many organizations or others in the community that say, why do you keep doing shelter? Why do you keep doing meals? Number one, of course, it's to keep people safe and healthy. But number two, it is that entry point. And so when you start providing somebody a meal and shelter, it just builds the trust level and allows us to introduce some other longer term solutions for our guests that are downtown. So that's the first piece. Second core strategy is rehabilitation. We've been doing rehab in different forms for a good portion of the last 35 years here at the mission. Here at the mission, we call it the New Life program. And so it can be up to a year-long program that gentlemen actually do come and reside at one of our locations for that long-term program. And we really try to build this holistic view, spiritually, education-wise, if we need to do that, but talk about what it looks like for them to overcome their addiction and then re-enter society as a self-sufficient citizen. So that's our rehab program. And we also do some transitional housing programs. So this is for working individuals, or they have some form of income, but they just cannot find an affordable place to live, which has been a challenge, especially here in Denver over the last several years. We call it our STAR Transitional Housing Program, and Jessica will talk a little bit more about this as that goes on at the crossing here in Denver. And we've been in that work for about 15 years. But again, that's a one-year program where single adults, seniors, or we have many families with kiddos that live at the crossing that are part of that STAR program. And so that's our third core strategy. And our fourth is community outreach. So this is the piece that mainly resides out of our Ministry Outreach Center, which is our warehouse here in Denver. And we provide food and clothing to individuals that, again, they're kind of on the cusp of becoming homeless. So they're making hard decisions about, do I pay for rent or food this month? Or do I pay my medical bills or food? And if we can provide some of those things that keep them out of homelessness, that's what that community outreach piece does. We also do our turkey drive and some other seasonal events that are kind of under that community outreach umbrella, so to speak, as our fourth core strategy. So those are just some of the things that we do on a regular basis. As Griff and Jessica will mention, we have pivoted quite a bit during this COVID crisis, but I just wanted to make sure we took this time to give that overview for some of you that may not have that knowledge kind of coming in, because it'll make the rest of this talk, I think, a little bit more accessible to all of you that are on the call. So at this point, I do want to turn it over to Griff Freyschlag. As I mentioned before, he's our Vice President of Development, and he is on our senior leadership team. So he's been really part of our response to this crisis from the get-go. And he'll talk a little bit about really specifically our emergency services and our shelter services and what that's looked like over the last 5 to 6 weeks as we've reacted again to this crisis. And yeah, he'll dive into some of that. So let me go ahead and turn it over to Griff at this point, and he'll take it from here.
All right, Brad, thank you. You know, up until this particular COVID crisis, I didn't even know what FaceTime was or Zoom calls or any of that stuff. So for an old guy to jump into technology has been a challenge, to say the least. And we have 7 grandkids, and I know that we're driving our family crazy with, I know, let's FaceTime. I know, let's FaceTime them. So I know a lot of you are in that same boat, and that's why I'm so appreciative that you've joined us today, that you've been Zoom called to death, but thank you for your interest in what's going on down at the Denver Rescue Mission and what we're doing in the city. So Brad asked me to talk a little bit about, and Brad did a wonderful job of talking about sort of what's normal. I've been at the Denver Rescue Mission almost 18 years now, and things have been fairly normal for a little while, but the last 10 to 15 years, nothing has really been normal. But this idea of what's happening now with reference to COVID and what we do and how we work with the city has really changed everything. So it's been interesting for sure. But as Brad mentioned, a pre-COVID, a normal day for us, we would serve about 1,500 meals a day out of our many locations, and we probably have up to 900 men and families. It's been up to 1,000 people that are staying with us in any one of our facilities throughout our particular system in one particular day. And back to the emergency side of things is that before the pandemic hit, a normal day for our men that are in our shelter would look something like they would all eat dinner downtown at our Lawrence Street Community Center, and then the city would provide buses, and each one, those men would go to one of 3 different shelters. One would be this is the Lawrence Street Community Center that you're seeing now downtown. And you can see the spacing issue, and that's obviously why we've made the changes we've made at that particular site. They would get on a particular bus and then go to 48th Street shelter, which is just up here north of I-70, basically I-70 and Colorado Boulevard, and 500 men would stay in that particular shelter. And then there would be another group of men that would go to our Holly Street Center, which is the fairly new permanent bed shelter that we built a couple of years ago. They were the first permanent beds that were added in Denver since 1989. Or they would stay downtown and shelter in our Denver Rescue Mission in our Lawrence Street site. So along came COVID, and it was very apparent that the city had to pull together to figure out how are we going to provide the spacing that this particular population needs. And Brad Miley, our president and CEO, is on the Homeless Leadership Council. And you can imagine the collaboration that it takes to be able to utilize resources in an efficient way to be able to take care of this particular group when there's so many different service providers and they all do such wonderful work. So the organizations that are involved in that are ones that you recognize. It would be the Denver Rescue Mission, Catholic Charities, the Colorado Coalition for the Homeless, Dolores Project, Gathering Place, St. Francis, Salvation Army, Urban Peak, and Volunteers of America. So through that Homeless Leadership Council, it was determined, and they visited many sites, the Convention Center being one, which we'll talk about in a minute, through a couple of other sites, and along came this opportunity to set up this new site right here at the National Western Complex. This is over at the Educational Hall. Those of you that have been to the National Western, you know that well. You know where that is. And it turned out to be a wonderful site to do what it is that we need to do to provide the spacing required. And we opened that National Western site on April 9th. So, it's been open, just about 2 weeks. And when you open a site and have 765 beds that have the necessary spacing, and hopefully you can see in this picture, they're 10 by 6 taped off. And so you've got 60 square feet where these men are able to space appropriately. And the same thing applies when they're eating there as well. So the Denver Rescue Mission is really the lead organization in that at that site. And so when people come in, we're responsible for checking them in. We're responsible for getting them a bed assignment, which things change all the time. But the last time I look at it is that I think you could reserve a bed for 3 days. Now that may have changed, but I think that's still the case. And then the great part is that working with the Colorado Coalition and the clinic is they're able to screen all of the men that come into that particular facility or before they get into the facility. And that has proven to be very effective to make sure that we're not, as best we can, to not let men come into that facility if they have any outward COVID symptoms. And so I think that we have screened approximately 100 men that we have then sent to the Stout Street Clinic or to Denver Health, and they get further tested and or just self-quarantined. And when those men reach that point, then the city begins to put those folks in one of, I think we're up to 300 motel rooms across the city that those men would go to. And either if they happen to have COVID, then there's a protocol that they follow, or if it's just a self-quarantining type of situation, they're able to take care of that as well. And I think the other population that we've moved out of the National Western to is those that are sort of medically or physically vulnerable that can't be part of that environment, or even men that are 65 years old and over. We asked that they would go and take advantage of the hotel room program that the city has provided. So let's see. I have some notes here, so hopefully I don't forget anything. Trying to take care of the families, the women and children, and the LGBTQ community is that the city, with the help of Catholic Charities, opened a 200 or 300 bed facility, or a space, if you will, over at the Colorado Convention Center, and that just opened this Monday. And I personally have not heard how that's gone. Maybe somebody who's watching here on staff, maybe Jessica might be able to speak into that, or anybody that has some information about that. That would be wonderful. Let's see. Back at the National Western site is that we are serving three meals a day there. We're working with volunteers. You folks who have volunteered. Many of you have already volunteered over at the National Western, which is wonderful. But those are opportunities to volunteer. They do have portable showers over at National Western, and they do have a contract with an organization that's coming in and washing blankets and just making sure the facility stays clean, let alone the cleaning staff that it takes to keep the floors clean, the railings clean, the tables clean, et cetera, et cetera. We are still serving meals downtown at the Lawrence Street Community Center. On average, it's between 300, 350 meals a day. So there's 3 meals a day we're still serving downtown. Now, most of the people that are taking advantage of that, these are folks that are still staying on the street. And there are volunteer opportunities to serve that group at Lawrence Street Community Center as well. We've been asked what sort of effect has this had from from our staff or our population or people at National Western? How many people have tested positive? How many people are actually being affected? So from a staff standpoint, I think that the last count that I have, and we get a daily up. This isn't something that we're not on top of. We get an update if that happens every single day, of course. I think we're up to 5 staff that have tested positive. As far as I know, most of those staff folks have simply quarantined and been home. I don't know of anybody that's been hospitalized. They've been home and are recovering well. With reference to our own Denver Rescue Mission population, these are folks that have been in our facilities, et cetera. I believe it's 15 positive tests. And those folks, of course, are then referred to Stout Street Clinic or to an appropriate hospital. And I believe that the positive tests that have come out of the general homeless population have been somewhere between 80 and 90 cases. And it's difficult for us to follow up on those to figure out how did they do. They simply sort of leave our purview, and it becomes anecdotal at best. Let's see. Fort Collins. Many of you know, we have the Fort Collins Rescue Mission, and we continue to serve men and women at the Fort Collins Rescue Mission. In Fort Collins, there's a community center there called the Aztlan Community Center, where all the meals are being served out of there currently. And we're working with Catholic Charities as well to make sure all the meals are going through there. Working with Fort Collins, the city of Fort Collins, and the Homeward Alliance group, just like we do in Denver. Everybody's putting their heads together, trying to figure out the best way to serve and create the necessary spacing that's needed up there. It looks like, and I kind of wish Brad Miley were on our call today, but I think that it looks like the National Western facility is going to stay open probably through the end of May. We don't know. So the city is responsible for that contract, the contract for the National Western, the contract for the feeding, the contract for the cleaning, the contract for the showers, etc. So it'll depend on the council to see how long does that need, or will that need to continue on. Okay, I think there hopefully have been you've jotted down some questions after my rambling, and we'll be able to answer those, but I'm going to turn it over to Jessica, who, as Brad said, is our Senior Director of Residential Programs, and she will talk about what's going on with our New Life program guys and our families that are staying with us in our STAR program. Thanks so much.
Thanks, Griff. So to follow up on some of what Griff was sharing in regards to the women at the Coliseum and the LGBTQ population, they can house up to 300 individuals at that facility. And their first night on Monday, they had 169. And so it went really well, and it's gone really well since then. Catholic Charities and Dolores Project are doing a great job getting that up and running. And so it's been a blessing to be able to partner with the city as much as we've been able to do to serve these populations. But here at the Crossing with residential programs, like they said, we have two. We have the Men's New Life program, which is focusing on getting the guys back to work and recovery, and the STAR Transitional Housing Program. Since COVID began, we've been given the adventure to evaluate how we can better serve these populations. And so some of the big changes that we've had to do was we've had to stop large group classes, large counseling sessions, and then just large gatherings of any sort around the crossing, which has limited our ability to run programs. And so to be able to think outside of the box, the counseling requirements, we've been able to get up and running fairly quickly with telehealth, which, as Griff said, is kind of a fun adventure for some of our older guys to figure out how to get onto the computer and Skype or Zoom in with a counselor, which has been thoroughly entertaining, but they've figured it out and they're all up and running well. For the recovery groups on the site for both programs, we have dropped the class size to groups of 3 participants with staff, which has allowed us the opportunity to social distance, clean spaces a little bit easier and more efficiently, as well as wear face masks. In both of the programs, we have been able to extend the length of the program. So both STAR and the Men's New Life program are 1-year programs. And so with the adventures of COVID, we've seen that people are unable to return to work, or their hours have been drastically cut, or they can't find housing. And so we've extended both programs to allow them more stability and time to be able to return to whatever our new normal is going to look like for both programs, as well, to ensure that they're provided for. Meals are free for both programs. One of the interesting things that we've been able to do at the Crossing with meals, and to ensure that we're doing social distancing, is we have changed our meal service at the Crossing. As you can see in the picture, we have limited the number of individuals coming into the dining area so that they can social distance, as well as wearing face masks. But we've also closed down the ability to gather there. So all of our individuals are either heading back to their rooms, which they've done really well with, or they're sitting outside and holding to the standard of 6 feet. And that's been going really well. So with some of the other adventures on the changes with COVID, the NLP is an opportunity for up to 110 men to come into this program and work on recovery and work on getting back to work. The STAR program is focusing on self-sufficiency, finances, and getting stable housing and the ability to afford to live in Denver. And so with that, the STAR program is a fee-based program. So some of the huge changes that come with that is, due to the impact of COVID on our participants, we've had to extend their program as well, but we've also had to waive program fees. And so the majority of our population is still currently working, but as of today, we've waived 18 families or individuals program fees, and we've extended 3 families past the 1-year mark, just to ensure that they have more time to get back to stability. The other big piece of the STAR program is the number of children in the facility. So the STAR program averages anywhere from 60 to 80 children on site at any given time. With all of these children and the families, we clearly have some issues with homeschool. And so we've been able to partner with the McKinney-Vento workers, who are the homeless family liaisons across the state of Colorado. And so with this partnership and their relationship, they have met with our youth department staff and our case management staff at the Crossing to ensure that all of the kids at the Crossing have access to the internet. They have their iPads or Chromebooks from Denver Public Schools, and we can also pull their school assignments with the liaisons. And so we're ensuring that our kids are still meeting their requirements at school and still actively engaging to a degree. The parents have done a great job on following up with case management, following up with the youth department, as well as reasonably following up to keep the kids on task, which is hard to do in this environment. And so All of our kiddos have the tech they need, and just in case they don't, we have capacity, thanks to generous donors, that we have backup iPads. So if anything happens to these kiddos' Chromebooks, or if they need access to printers, we've got staff who are ready to jump in, and we have it ready to go. So if that comes up, we're good to go. The other benefit to having staff in the youth department and the relationships with the school districts that we do is trying to keep these kids entertained, since all the playgrounds are closed. For those of you who have not been to the crossing, the Star families reside in a large motel room. And so at times, as we can all imagine, that's a pretty cozy space for kids that don't get to run around outside and play. And so thanks to a lot of donors and a lot of YPers, we've been blessed with tons of activities for these kids, and tons of games, tons, as you can see in these pictures, tons of games, tons of art and crafts, and thinking outside of the box on how we can have stay-at-home movie nights in their rooms. We've had donors provide pre-made popcorn and candy to give some sense of normalcy to these families. But these gifts of games and school activities and arts and crafts and puzzles have just been a saving grace for these kids and families. So we thank you for anyone and everyone who has participated in getting these supplies to the family. They were well received, and such a blessing. Some of the other things that you will see around the crossing is case management is still mandatory for all program participants to meet with. So to ensure that our participants feel safe and our staff feels safe, we are allowing teleconferencing or Zoom. We're allowing phone calls to replace meetings. Some of our participants want to come and meet face-to-face, so we just allow social distancing, lots of hand sanitation. We've provided face masks for every participant and every child in the facility, where they can have 2 per participant so they can wash them. And still create that sense of normalcy, and still give them the touch points they need with staff and individuals around them. And so those are some of the big changes as we pivot with COVID and we all join in this adventure. We'll continue to evaluate the needs and changes and the rollouts that the government plans, and continue to meet those needs for our participants around us. So Brad, I'm going to hand it back to you.
Awesome. Thanks, Jessica.
Welcome.
All right. I do have a list of questions that were kind of the pre-form questions that came through as folks registered for this event. So thank you again for submitting those. And I just want to encourage everyone that is listening, if you do have additional questions, please go ahead and get those submitted, and we will answer and kind of use the last 20 minutes to do this live Q&A. So we invite you again, don't be shy. If you have questions about what's going on, or what our response has been to COVID, we'd love to answer those. First of all, Griff, I'm going to throw this one over to you. I know we have gotten some questions just about the financial impact to the mission and kind of what the community response has been so far from donors and others in the community as we've had to make all these pivots. And so I guess the 2-part question, kind of what are the additional financial needs that the mission is facing? And then second, what has been the response so far from the community and from our donor community?
You bet. So probably the very first increased expense for us was simply sort of facility oriented. How do we make sure we keep everything clean? How do we get enough cleaning supplies? Like every organization, even anybody that has any number of people involved in it, how do we get the masks that we need, etc. And then came the toilet paper rush that everybody experienced, and just a great segue into how is the community responding is the Broncos found out about that, and since no one's at Empower field, they reached out and were able to send us quite a bit of toilet paper. But we're having difficulties finding just the goods that we all are having difficulties finding, even though we have, you can imagine, we've got vendors that provide a lot of things to our warehouse on a really high volume basis, but that continues to be a bit of a struggle. On the financial support side of things, it has been humbling to see how the Denver community has joined in and given sacrificially. I mean, the stories are heartwarming when we get notes from folks that say, hey, I live on a fixed income. I wish we could do more. We can't get out of the house, and they're giving, what they can give, and it is it's truly, it's pretty exciting. The foundation community within Denver has been fantastic. They have all stepped up, and they're supporting not just Denver Rescue Mission, but supporting so many different organizations in everyone's effort to try and provide the materials and services and staffing. As I think I mentioned, is that we've hired 35 additional employees for this particular time, and the reason that, not only because we have added services, but it's because we have some people on staff that are home, that can't work because of their age or because of whatever situation they have. So we've had added staff expenses and had to go out into the community and hire folks for that. But on the fundraising donation side of things, we have been blessed. It's pretty amazing.
Great, thanks, Griff, for that.
Yep.
That overview. Jessica, let's throw it back to you. I know that we did suspend intakes on New Life program and on the STAR transitional housing program as well for a period, just as we were coming into this situation and just trying to really take care of those that were here. Has there been discussion about opening that back up? And that would include Crossing and likely Harvest Farm as well, where we have some additional men in our New Life program. Have there been some decisions made on that?
There has been. With the governor releasing some of the restrictions, we are set to start doing intakes again on May 4th. And so that would be for the Men's New Life program. We've started discussions on how we're going to do that at National Western with our intake team there, as well as how we're going to open it up for STAR and get the information out there that we are opening it up that week, and then hopefully starting move-ins the week of the 13th. And so right now we still have a fairly significant wait list for the STAR program to get in. So we're going to call obviously all of them first to see if they're still interested and need housing, and then go from there.
Awesome. Thank you for that update. Some of the other questions that we have received, again, previously, what can people do from home, Griff? Like what are some of the things, obviously, other than, make a gift or continue to be in prayer for our staff and our guests and our participants, but are there other things that folks can do from home or from afar? I know we have some folks even that are out of state that have signed on for this webinar. If you could just share a little bit about some of those ideas and what's going on with the mission in that area.
Sure, you bet. So one of the things that, I mean, the obvious one is we certainly covet any financial donations that you might have. That would be wonderful. The other thing, that as opposed to getting out and going to the store yourself, you can certainly go on to Amazon or Amazon Smile. You can go to our website and check our greatest needs, and there's a list of the items that you could go on and order and have shipped directly to the Denver Rescue Mission. But I think Brad hit the nail on the head, is that prayer is so important. We really appreciate any time that you have to pray for the folks that come to us for hope, folks that are the most vulnerable, and continue to pray for our staff, especially the staff that are on the front lines. I mean, day in and day out down at the National Western and downtown. It's a stressful time for everybody, even when you don't recognize it. It's stressful.
Great, thanks, Griff.
Mm-hmm.
In terms of greatest needs over at the crossing, Jessica, I know you mentioned some of the kids' activities that have been collected. Are there other needs right now that you can speak to?
Currently at the crossing, we have been blessed with an abundance of kid stuff. So as of right now, we are full there. We are full with electronics and iPads. The biggest need that we have right now is financial, with trying to help participants remain in housing and us waiving vouchers. Every room is approximately $700 a month. And so to ensure that they are safe and stable, we want to make sure that we can keep them here versus during the duration of COVID. So those are our biggest needs right now.
Great, thanks, Jessica. And do you have any sense, it might be too early to tell, but I just know the economic impact of this crisis is, clearly nationwide, and Denver is not immune to that. What do you foresee for the next, 2, 3, 6 months in terms of needs, and especially families that are going to be in need of an affordable place to live? Have you given that much thought, or has there been any discussion around town in your network about that?
The interesting part is a lot of our families who are ready to move out and be on their own can't find housing because they're not opening up the apartment complexes for people to apply and do walkthroughs. And so until those are a little bit less restrictive, we're just going to continue to evaluate how long we can extend the program. So for STAR, with us being under some of the directives of HUD, we still remain in compliance with HUD. And so that's one of our biggest limitations, is making sure that we're in compliance, but also providing the flexibility our families need. And so we're just going to have to wait and see and keep extending it to ensure that they're safe and stable, and evaluate it as we go. I did think of one need that we actually do need, thermometers. So anybody for some reason has a thermometer where it just scans the forehead but doesn't touch, we definitely need 2 more of those at the crossing. So that would be a big need.
Awesome, thanks, Jessica. Yeah, I know we've been working hard with our VP of operations, and I know he's been trying to source those kind of materials, and I think we did get a shipment from China, actually, some of those scanning thermometers. But we're, like many other organizations and businesses, everyone's going to be trying to get those in place, as that's just one additional way that we can screen at some of our other facilities. As Griff mentioned, we partnered with Colorado Coalition for the Homeless, and they are doing their health providers are doing some of the screening at National Western. But as we kind of open up and we start to do intakes at our other facilities, it's going to be very curious in terms of how we're able to screen those participants as well. So we're working towards that, and yeah, it's another area of need for us for sure. Let's see, we have another question come in. How are volunteers being protected, and how do we go about signing up for shifts? I think that's one good question. Griff, if you could speak to that just a little bit, how volunteers are being screened and protected, and what does it look like down at National Western to volunteer?
So, Brad, I might actually throw it back to you because you volunteered. You've been down to National Western, but I will say down at Lawrence Street Community Center, volunteering downtown is, I would say, fairly benign, fairly low risk, because we have masks, we have all the normal volunteer physical setup down there. But even now, serving meals, you're behind the serving screen, if you will. There's not any interaction with any of the outside guests when they're eating. So it's pretty safe. Now at National Western, there's 680 people in there, and as opposed to 100. And so maybe Brad, you probably would better address that than I would.
Yeah, I've been down there a couple of times. It's you're still in a group of 12 to 15 volunteers, and you're serving meals, you're serving out plates, so you're quite literally an arm's length away from your fellow volunteers. But everyone's in masks and gloves, and we're doing our best to keep everybody safe. Again, as some of the photos, especially over at the crossing, Jessica showed, participants and guests are highly encouraged to stand 6 feet apart in line. And same thing as they're coming through to grab their meal. And so, I think it's there's definitely a risk. I mean, everyone on the front lines, there's a risk of catching this thing no matter where you're at. You can get it at the grocery store, but we've taken every precaution that we possibly can. We still are encouraging volunteers to bring their own masks, and that's simply because we're also having difficulty sourcing those products. And I know my family, we all have masks now, so anytime we go out of the house, we're wearing them, and we would just really encourage our volunteers to do the same when they come out to serve. But it has been amazing as we've sort of watched our volunteer counts. It's the last 2 weeks at National Western, a significant number of folks continue to come out, and almost every meal is fully staffed and helped by volunteers, which has been awesome. We are the lead provider at National Western. There are others, of course, that have stepped in. Actually, their catering service that normally serves meals at National Western for special events, they're the ones that are providing meals under the guidance and the contract with the city of Denver. But we're the ones that are actually serving it to our volunteers. They cook, we serve. So it's a great partnership. And again, if you're under the age of 65 and you are healthy, I would highly encourage you to take that step and come on downtown and serve a meal at National Western while we're there. Let's see, another question for you, Griff. If folks do have donations that they'd like to drop off, food or clothing or that kind of thing, is the Ministry Outreach Center still open? Like, where do they go to do that? How's that process working through this crisis?
Yes, so the Ministry Outreach Center is still open. It's you can find the address on our website. It is as you follow the directions off of 39th Street and pull in there. There's a buzzer, and it's very good at social spacing. And there's someone there that can help you and unload any food or any GI gift in kind or any clothing that you might have to donate as well. We are not picking up any furniture right now. None of our trucks are going to anyone's home. So I would imagine that will pick up again at some point. We just don't know when, but that's sort of how that's all being handled right now.
Great, thanks, Griff. I think one of the other things too, I want to just step back and mention about protecting volunteers. Of course, if you're going down to National Western, there is that health screening check coming in the front door. So, our staff and our guests have, can have a pretty good sense that at least nobody has a fever. We can't guarantee, of course, that COVID is not, is not present in that population, but there is that level of screening, especially now at National Western right now, that really just heightens that sense of security, and that we're doing our best to keep everybody safe. So, and Jessica also mentioned here in one of the chat features, the crossing will again be opening up for volunteers at some point in May. Help serve meals there as well. We did sort of consolidate and shut down the ability for individuals to volunteer at the crossing for the certain period for the last month or so. We are looking at opening that back up as well as we sort of gingerly step into the larger services, and as she mentioned, opening it back up to allow people to join that program again after a 4 or 5 week hiatus that we've experienced here over the last several weeks. So, all right, any other questions that we have out there? Griff, one of the other questions that we had previously, I know that there were some questions about, are we doing chapel services at National Western? I know that we, when we've been at our Lawrence Street shelter, we do have a nightly chapel service there. Do we know if that's happening at National Western?
Do you know what? I do not know if it is. I don't think so, only because I can't envision a space within the National Western where you would be able to bring people together that isn't socialist, that isn't social spaced well. So I love the idea, but I don't think it's taking place right now. I don't know, Jessica, do you know if it is? Yeah, I don't think so.
Yeah, I think one of the things I will mention, you know, we do have our staff down there. We have upwards of 50 plus staff that are, of course, they're on shifts, but they are definitely helping provide some guidance to folks. Our peer navigators have continued to do their work, and I know they have a booth there at National Western. So as gentlemen are checking in, there is that ability to start building that relationship. So my hope and prayer is that, you know, just having that space and having guys there 24/7 right now, that it is allowing them to build some relationships with our staff during the day that could, you know, essentially result in you know, people finding their way out of homelessness, coming to Christ for many of them. We know that those stories anecdotally are happening, and so we just continue for you know, ask you all to pray for those relationships and how they might blossom out of this crisis, and, you know, just having a different a whole different attitude in terms of how we're serving folks has definitely changed. And so I would just ask you to continue to pray for them and what's going on downtown. And a final question. I know there's a question about masks and if they're needed or if folks can provide those or be sewing those at home. Griff or Jessica, I know we've had several church groups and individuals from churches that have dropped off some of those masks over the course of the last month. I don't know if you've heard any other stories anecdotally, either of you.
Yeah, we have received quite a few at the crossing. I can speak to, I picked up 150 from the monument area and brought them up, 30 for kids, 120 for adults. And then the Colorado Medical Society has also provided 420 adult masks and 25 kids masks. And so we started giving them out at National Western. And right now, National Western is asking that they don't receive any sewn masks because it's difficult for the guys to consistently wash them. And so we don't want to see them thrown away or wasted. And so some of our men are wearing them, some of them are not, but they do have access to them there. So right now, we've been blessed to give everyone at the crossing 2 masks each. And we still have a backup of 100 masks. So right now we're doing great. So I appreciate the help.
Yeah. That's basically what I've heard from just kind of operationally is I think that the mask situation has, production has increased where it needs to increase and the deliveries are happening when they need to happen. So I think we're good.
Awesome. Sounds good. Well, I think we're coming up on time here. We're 1 minute to 1 o'clock by my watch. And so again, I just want to say thank you to everybody that tuned in for this webinar. I would imagine we'll do a few more as the next months, weeks and months progress into the summer. And so be watching out for those. I also want to encourage you once again to follow up with additional questions that you might have. Mindy and Christy, both, I'm sure we'll be reaching out to many of you just to kind of, again, follow up and see if you have any additional questions and find out if there's ways that we can pray for you. Quite honestly, this community of donors, we consider ourselves the DRM family, and we do want to know if you have concerns or health concerns or family needs that we can help provide for. That is part of our responsibility too, as just general members of this community. And again, we thank you so much for your support. And I don't know, do we have Mindy and Christy's contact information Christine, I think we were going to try to share that before we signed off. There it is. And again, just some of those links if you want to sign up to volunteer. We do have a running blog now for COVID-19, so we'll continue to update that periodically as we, again, continue to move through the coming days and weeks. And there's Christy and Mindy and their email addresses as well. So again, thank you so much for joining us. And Griff, would you like to close us in a quick prayer, and then we'll be on our way.
You bet. Yes. Thank you, everyone, for taking time out of your day to visit with us and just learn more. And we're so thankful of your trust for what we do. Thank you. Thank you for that. Lord, we depend on you 100%. You are the one that is in control of all of this. And as frustrating as it can be in the stories that we hear and the heartbreak that we see all over the country and all over the world, this is not going away anytime soon. So we continue to pray that everyone has the opportunity to know you and trust you in an environment that many times is pretty hopeless. So thank you for loving us. Thank you for standing by us. And thank you for our donors and our volunteers and our staff that are working to take care of those that mean a lot to you. So thank you for our time together, and we love you. Amen.
Amen. All right. Thank you, Griff. Thank you, Jessica. Thank you, everyone, again, for signing in. Have a good day.
Thanks.